The United Nations Children's Fund warned in a statement that millions of children in Yemen are at risk of contracting diseases if they do not receive routine vaccinations and basic nutrition services. This report has more.
Recent UN reports revealed that social, health, and economic systems in Yemen still represent a danger after more than 8 years of conflict, which has exacerbated needs in all Yemeni sectors, especially for millions of children who are threatened with diseases. Activists and human rights organizations accuse the coup group of continuing corruption and preventing routine vaccinations amid their continued systematic destruction of the medical sector. In a statement, the United Nations Children's Fund warned that millions of Yemeni children are at risk of getting diseases if they don't receive routine immunizations and basic nutrition services. Unicef stated that lack of timely funding puts millions of children in Yemen at risk, as more than 1 million Yemeni children under the age of 1 year lack routine vaccinations, and more than 4.8 million children will not receive basic nutrition services. According to the organization, 11 million Yemeni children are in need of humanitarian assistance and protection, and warned that the lack of funding for urgent interventions would pose a challenge to the continuity of basic services, putting the lives of Yemeni children at risk. UNICEF needs more than $400 million to respond to the humanitarian crisis in Yemen and to meet critical needs in areas of health, nutrition, water, sanitation, child protection, education, and social protection during the current year. Meanwhile, the World Food Programme said it was forced to make cuts in malnutrition prevention activities in Yemen that previously targeted 1.4 million people. As a result of the lack of resources, WFP will only be able to assist 128,000 people in Yemen out of a total of 2.4 million children, pregnant and lactating women and girls who were initially targeted. The World Health Organization had revealed several weeks ago that 24,000 cases of fever had been recorded in Yemen in the first quarter of this year, attributing the reason for stopping vaccination campaigns. The organization monitored more than 23,000 cases of fevers and viruses, including 13,000 measles cases, 1,770 cases of dengue fever, in addition to 2,080 suspected cases of cholera. The peace process in Yemen has yet to make any significant progress, yet Yemenis still have hope for a better future.